Hi, my name is Stephanie Hertz, Marketing Director here at Workforce Retirement Community. Workforce is the premier sponsor for the Lifelong Learning Society, and we welcome you to the Riverside Lecture Series. Today, I have the pleasure of introducing Tina Thomas. Tina Thomas first came to Riverside in 2014 as a volunteer chaplain at Doctors Hospital Williamsburg, bringing her passion and enthusiasm and 25 years of healthcare leadership with her. Tina has rejoined the Riverside staff as the Executive Director of Memory Care and the Center of Excellence in Aging and Lifelong Health. Tina formerly worked for the Alzheimer's Association as a Senior Director of Programs and Services for the Greater Richmond and Central and Western Virginia chapters. Under her direction, the chapters grew significantly and positively influenced hundreds of families affected by memory loss. Tina is currently pursuing her PhD in healthcare leadership. She has a bachelor's degree in healthcare administration as well as a master's degree in hospice and palliative studies. She has advanced degrees in gerontology, addiction specialist, pastoral care, nursing home administration, and Alzheimer's and dementia care. Tina is also a Dementia Friends champion and a facilitator for the Rosalind Carter Institute's Dealing with Dementia program. Tina resides in Williamsburg with her husband, children, grandchildren, and her pet turtle, Yertle. Please welcome Tina Thomas as she speaks on 6 tools to boost brain health.
That was lovely. That was a lovely surprise. Well, hello, everyone, and thank you so very much for allowing me to come today to talk to you about healthy aging in retirement and beyond. Now, can you all hear me okay? Wonderful. So I'm thrilled to be here today with my esteemed colleague, Kim Kuttner. And so she's here and will be able to answer any questions that I get stumped on, because it looks like to me, these are some of the smartest folks in Virginia that are in this room today. So today we're going to talk about a couple of core things: education, support, assessment, research and innovation. And that's going to give you some information about the center where I work and Kim work and what we do. Now, you did hear in the introduction, the Center for Excellence in Aging and Lifelong Health. Our name will be changing soon to the Martha W. Goodson Center. And that is truly due to honor Martha Goodson and the generous donation of the Goodson family. On your screen now, you'll see all the many different ways that the center will support folks in the community. We support folks who are impacted by memory care, those who are impacted by driving. They need some support with their driving assessment. We have online learning tools, a lot of services for those needing support. We do have a comprehensive geriatric assessment center, and that's where people come to get an overall comprehensive evaluation to figure out what is going on. Something's a little off. I'm not quite sure what it is. We call it the worried well, and they can do a comprehensive assessment to help determine what is going on and provide some support. We do work on a consultative basis with your provider. So we don't offer the ongoing treatment, but we do give some guidance and support to providers. So this is just an overview of some of the services that we provide at the Martha W. Goodson Center. Today, we're going to be talking about some tips and strategies and things you can do to help our brains function better as we are getting older. We're talking about the basics. This program is a collaboration of information brought to you by the Administration for Community Living, as well as Riverside Health Systems. Let's start with aging. Aging well depends on 2 primary factors. Now, some of you, I know you're writers and you are taking copious notes. We can make sure that you get a copy of this slide deck so you don't have to wear your fingers down trying to write every single thing down. Aging well depends on 2 factors, primarily your genes, not your blue genes, your genes, the one we get from our parents, and our lifestyle. how we live every day. We get a certain amount of genetic makeup from our parents, and it really does determine a lot of our lifestyle factors. And some of those are things that are built in. There are things you can do in your lifestyle to make changes to make your living better. We can improve certain skills. We can improve our thinking skills, learning skills, vocabulary, our mobility. Some of those things we can change. There are some things that we inherited from our parents that we can modify, and others we cannot. We have to just do the very best we can. So when we're protecting our brain health, there are a couple of things we want to strive for. Healthy eating, the things we put in our mouth, we can control those. Although sometimes I feel like I can't control it with that donut. I want it, give it to me. I can't control it. But they tell us we can control what we eat. Regular exercise, moving, keeping the brain active, social connections, and getting enough sleep. The one on this screen that a lot of people ignore is keeping the brain active. I think we've heard now from our providers, I gotta change my diet. Eating those dark green leafy foods, they really do help. There are certain things I need to do. We've heard it for years. So we're doing better with the foods we're choosing. And then we're doing better with moving because we have to move. You gotta move it or you lose it. We're doing better with moving. We're even doing better with social connections. We learned during this pandemic how important it is to be with other people. Even people who don't like to be with other people miss being with other people. We learned that during the pandemic. And then getting enough sleep. Our providers are even talking to us about that. The one that we don't talk a lot about is keeping the brain healthy. What do I need to do to keep my brain healthy and engaged as I'm getting older? So we're going to talk a lot about that one. Let's start with healthy eating, good nutrition. One of the things that is superb is water. Are we getting enough water? When you become dehydrated, it's a cascade effect of bad things that can happen. Not only can it make us foggy, but it really does impact our bodies, our cellular structure. People are more prone to falls when they're dehydrated. Drinking water is essential. We want to drink more water, really pay attention to our salt intake. We need more fruits and vegetables, and there are lots of ways we can get fruits and vegetables on board now. We can make a smoothie. There are a lot of different things that we can do. We can grab a banana, even if you have, those modifiable teeth in our mouths. So you can throw it in a blender and mix it up so that you can still absorb some of those nutrients. Thinking about portion controls and the types of food that we're putting in our body. It's very important as you start thinking about things you want to be eating, talk to your doctor about it. Because sometimes the medications we're taking could be a contraindication for certain things. So I take a medication every day, and because of it, I can no longer have grapefruit. I forgot that the other day when I was at a meeting. I was like, oh my God, grapefruit juice. It looks so great. I started sipping, and then immediately I started to feel a reaction. I had to drink water to help offset it. So make sure you talk to your doctor or your pharmacist about different foods and how they could interact with different things that you're taking from a pharmacological perspective. Regular exercise, moving. Physical activities is one of the most important things you can do to stay healthy. Now, there's some smart folks in this room. Let me find a couple of them to ask. What are some of the things you do every day to keep your body moving well? Constantly walking around. Yes. How about you? She does seated yoga. Yes. How about someone up here in the stands? What are some of the things you do every day to keep your body moving? She puts on her ugly clothes and runs every weekday for 25 minutes. She's got me beat, I can tell you that. How about you in the back? What do you do? She has a smart walk, and that smart walk watch nags her until she gets up and gets going. And after she gets up and gets going, it tracks it for her, and then it gives her a big boom. You did a great job today. Awesome. Moving. There are lots of ways we can move. We can park further. You can sit down. There are lots of ways you can incorporate it into what you do. When you get out of the shower, you can do leg lifts. While you're at the counter in the kitchen making your breakfast, you might hang on to something. There are lots of ways you can make the body move. By moving, you reduce your risk of diabetes, heart disease, depression, and strokes. Now, there's another one on here there's another one that's not on here that's a big one. Moving reduces the risk of diabetes, heart disease, depression, and strokes. All of those are significant risk factors for dementia. If for no other reason you want to get moving because you want to reduce your risk for developing dementia. If you have diabetes, you're significantly more at risk for developing dementia. The same thing for heart disease, and depression can look exactly like dementia. So getting up, going outside or in the house, lift up the window, getting fresh air so you can get good oxygenation to the body and get moving. Now, another wonderful way to get moving is if you fall in love. I know some people have gotten divorced. Some people are still married. If you fall in love, you know you are excited. You want to go for walks. You want to hold hands. You want to do lots of lovely things. If you're already in love, deepen the love and just do something romantic, fun, and lovely together. It's important. It can also improve connections among the brain cells. Eating certain foods can improve those connections. Make sure that you talk to your provider about any type of exercise that you're planning to do. You want to make sure it's safe for you. Now, talking about keeping the brain active. Keeping your mind active may help you maintain your learning, remembering, and thinking. By keeping your brain active, it is the #1 way you can help to reduce your risk of having to move out of your home. Many people say, Tina, I am staying in this house. I'm leaving feet first. I'm never leaving this house. Great. If that is your goal, you definitely need your mind to be strong and to be healthy. There are lots of activities and things you can do, and I'll give you some cool little strategies to help keep your brain active. Staying connected with other people is very important. People that live alone, there's oftentimes they could go days without ever speaking to someone. When I provide support and counseling to families, sometimes they'll say, Tina, my mother, she's losing her language. She is having a hard time getting her words out. I said, yes. She said, mother lives alone. Yes. I said, well, how often does she have an opportunity to speak to someone? If you don't speak to people and use your language, you will lose the ability to use those skills the way you once did. And pulling language forward, forgetting language, forgetting the words. You wanted to say something, but you can't think of it, so you pull another word out. The fluency of the words. One of the things you can do to strengthen fluency of words is by simply reading aloud. So many of you read the newspaper or an article every day. If you read it out loud, it helps pull language from the back of the brain to the front. Reading out loud, very important. And for those of you who forget things, like, darn it, what did I go in that kitchen for? And you just stand there, and you go back. One of the things you can do is when you stand up, say, I think I'll go get me a glass of water. Say it to yourself out loud. You hear it and you feel it differently when you say it out loud. So use your words, use your language. Stay socially connected. Make it a part of who you are to talk to someone every day, even if it's a stranger. Say, good morning, how are you? Every day, you need to engage with someone. You could consider volunteering again. You could join a social club. Stretch yourself. Consider doing something you would have never done before, like line dancing. Whoa, line dancing is an exceptional activity for brain health because it strengthens several parts of the brain at the same time. With line dancing, you have to look, you got to listen, you got to move, you got to follow commands all at the same time. So dancing is an exceptional way to stimulate your brain. Now, here are some risks, things that are barriers to brain health. Accidents, falls, number one reason why folks over the age of 65 go into the emergency room. Alcohol, having 4 glasses of bourbon a day will impact your thinking ability. Smoking, some medications, yes, things that we take to help us sleep. Sometimes they can make us groggy, a little lethargic. Even Claritin D. There's a mechanism in Claritin D that does what it's supposed to do. It can make you a little foggy. And then other health conditions. So being sure that you talk to your provider about these. Now on the screen are some facts I want you to know about these barriers that could impact how well our brains work together. It's estimated that 6.5 million Americans are living with Alzheimer's disease proper. It is the 5th leading cause of death for folks over the age of 65. Nearly 10 million new dementia cases are diagnosed every year. That's around the globe. Globally, about 55 million people are affected. The numbers are considerably growing and they are expected to triple. 60 to 70% of dementia is associated with Alzheimer's. And I'll talk to you about that in 1 second. Globally, someone develops dementia. Watch this. Every 3 seconds. About 78 million people will be impacted in 2030. It's not that far away. And then families and friends provide the majority of care and support. The majority of people who are impacted by cognitive issues, brain changes that really is impairing them, live at home in community. I can guarantee you drove past somebody or walked past somebody or rode here with somebody who has some level of an impairment. Now, the question we get asked often is, what is the difference between Alzheimer's and dementia? And are they the same? Dementia is not a disease. Let me hear you say that. Dementia, oh my gosh, let me help this choir. Let's try it again. Dementia is not a disease. It is a syndrome. It is an indicator that there may be a disease. The disease could be Alzheimer's. Alzheimer's is the #1 factor for dementia-related issues. Dementia tells the provider, your doctor, that you're starting to have some changes as it relates to your memory, your thinking, your mood, your language, your behavior. And then what they want to do is some additional testing to figure out what's making that happen. If you ever go to the doctor and the doctor says, we think it's dementia, or, well, you're 85, it's dementia. The first thing I want you to say to the doctor is, what are you going to do about it? What are you going to do about it? And the next thing you want to know is, what kind is it? If I've got dementia and there are over 100 different diseases that can cause dementia, what you want to know is, what kind of dementia is it? And the reason that's important is all of these other diseases behave differently. If you have Alzheimer's type dementia, people with that disease, it's called slower onset. They're more prone to wandering. They love to collect things. People who have Frontotemporal dementia, the dementia starts in the front of the brain and on the sides. They have more behavioral issues. Lewy body's dementia looks a lot like Parkinson's. Folks are more prone to falls. You want to know this because if you are one who said, I'm aging in place, I'm never leaving this house. If my partner gets dementia, I need to know what kind it is so I can make an informed decision. Can I truly care for this person in this home with what I know about this disease? And it certainly can help with planning. Not the same, under the same umbrella, but not the same. Dementia, it's general. The greatest risk for developing dementia or Alzheimer's is age. Age is the greatest risk. Genes, there is some genetic connection, but it's very, very low, less than 5%. So for all of you who are saying, my mother had Alzheimer's, that's it, Tina, I'm doomed. My mother and my father had it, and 3 of my mother's sisters. The first question I asked is, how old were they when they were diagnosed? The older you are, the more likely you are to bump into Alzheimer's. But the risk is very low compared to the number of older adults, and it's even lower from a genetic perspective. If you've had head injuries or something else impact you, if you had multiple strokes, you could have dementia-like symptoms, but not Alzheimer's. Alzheimer's is a type of dementia, but not every dementia is Alzheimer's. Does that make sense? And then you hear about mild cognitive impairment. Now, I've been doing this work for 36 years, and people would say, oh God, I'm terrified of Alzheimer's. And then it went from being, well, I'm not afraid of Alzheimer's. Tina, I do not have Alzheimer's. It's just dementia. Now, folks will say, oh no, I don't have dementia, Tina. I only have mild cognitive impairment. Well, mild cognitive impairment, oh, she's showing me I can do this. Mild cognitive impairment is that you and or your provider is starting to notice changes, but they're not significant enough to impact how you function every day, and they won't show up on the test. So for all of you who went to the doctor, they gave you the test. You know the test. Give me the 3 words. Draw the clock. Count back from 100, from 7 times back. Any of you who've had the test, if it's mild cognitive impairment, you might be able to pass the test. That doesn't mean that the impairment is not there. It's just not significant enough to impact how you live every day. About 15 to 20% of people age 65 or older have mild cognitive impairment. Now, you might be surprised to know that people around the age of 45 start to report that they have brain changes. It's called subjective cognitive impairment around 45. And the other thing you might not be aware of is right at around 40 is when our brain naturally starts to change. It starts to shrink. And it's a natural part of the aging process. You lose about 3% of the weight of the brain every decade. It's very slow, and no, it cannot be stopped, and it is not reversible. It is a part of the aging process. And it causes a phenomenon that most of us will bump into. It's that phenomenon that makes you go in the kitchen and just stand there and go, oh God, what did I come here for? Or it's the phenomenon that makes you say, oh God, here comes my neighbor. Oh God, here she comes. Here she comes. Oh God, I know her name. I know her name. I know her name. I know. What's her name? What's her name? And I can't call her name for nothing. And I just say, hey, sugar, how you doing this morning? Because I cannot. And then you remember it later. It's called forgetfulness. We all will bump into forgetfulness at different degrees. Forgetfulness does not mean dementia, and it does not necessarily mean Alzheimer's. Other risk factors: accidents, brain injuries, not caring for ourselves, lack of water will cause you to have some difficulties, not getting enough sleep at night. These are all things you want to do to take care of yourself for your brain to work at its best. When you go to your doctor, you want them to check everything from head to toe. Did you check my eyes, my ears, my ability to walk, function, move, twist? Everything has an impact on how we think and how we function. One fall could really change our lifestyle. People are really worried about some big event. Yeah, you could trip over the curb outside, and there's a life-changing event. Alcohol, you really should be talking to your doctor. Yes, I know they recommend that we drink wine. You want to ask your doctor, how much wine can I have for my body size and weight? Because as you get older, your body, it absorbs the alcohol differently. So I know you've always had 3 glasses of wine and you've had that for the last 20 years, but your body is absorbing it differently and it could be affecting you differently. So really talking to your provider, how much can I have? Alcohol, it can impair your communication. It can make you more dizzy. It could have a long-term impact on your balance. There is a dementia directly associated with long-term alcohol abuse. There's a dementia that happens from long-term alcohol abuse, and you see it a lot with younger folks. So it's very important. And then smoking. We've heard about this for decades, but for folks who are still smoking, that cigarette smoke does impact our arteries, particularly folks who have heart conditions and that are diabetic, and puts them at greater risk. It's not just you smoking, but being around someone who's smoking. Asking them, could you step outside, please? Especially if you're around it on a regular basis. Secondhand smoke can have the same effect as if you were smoking it yourself. So it's very important. Other risk factors. Some of the medications that we take can affect how our brain functions. Absolutely. The single underutilized gift that we have in our communities is the pharmacist. The pharmacist. Talk to your pharmacist about your medication. Now, I'll say this because I get asked this question every time I talk about dementia or brain health. They say, Tina, I saw it on the television. Does it work? The Prevagen. And I say to them, ask your pharmacist about Prevagen and get their feedback on it. What I know is that I try to offer people things that are evidence-based and have FDA approval. Ask your provider about Prevagen and see what they say. And people ask me the same thing about coconut oil, blueberries. I heard it, Tina, it works, it works. And I say to them, if it's working for you, use it. But talk to your provider about it. Other risk factors and conditions. We talked about heart disease, blood pressure, diabetes, and sleep problems. There's new research that shows that people who do not get 8 to 9 hours of rest every night, uninterrupted rest, really sleeping, are at greater risk for developing dementia. I'm in trouble because I've been sleeping 6 hours for years. And so I've got to figure out another mechanism to go to sleep at night and truly rest. Not being in the bed, but really sleeping. So I might be one of those persons who needs a sleep aid to help me go into deep sleep. Heart disease and stroke, the things that you do to help reduce your risk for high blood pressure, heart disease, and stroke also work really well for your heart. There is a direct heart and head connection. It's 12 inches from the brain to the heart. You want to do everything you can to keep that connection and those 12 inches open. Everything that you're doing to keep that heart going works really well also for brain health. For those who have diabetes, thinking about the vessels. That's how the blood gets through the body, it's how it gets to the brain. We want to make sure it's well oxygenated. And we're doing everything that we can to reduce your risk for memory problems and Alzheimer's disease. Now, there is not a cure today for Alzheimer's disease. There is not a cure. There are medications on the market that help manage the symptoms, and aducanumab and lecanemab are the first medications that are on the market that can change the trajectory of the course of that disease by removing some of the amyloids. It gives you more time to live your best life, but it is not a full treatment, a curative mechanism, treatment, not a full cure. So everything that you can do from a preventative perspective to keep the brain working, you want to do it. And you have to do it and be very intentional about it. What am I doing today to help my brain work as well as it can? What am I doing today? Walking is one thing. What else can we do? What can we do every day to help with brain health? Give me an example of something you can do every day, Kim. Kim does brain games. She does those brain games every day to help her brain work its best. Yeah. She might not get it right, and that's okay, because of something called brain plasticity. In your brain, you've got neurons. The neurons in your brain send information from one to the other. When there's a damage, like a stroke, that part of the brain dies. And what the speech therapist and the physical therapy folks do is they teach you how to make those neurons go a different way. It's tracks, almost similar to when we go skiing. They're tracks. The brain follows the same tracks all the time. But if there's an interruption, you can train the brain to go a different way and reroute it to get something done. It's called brain plasticity. The problem, if you have a dementia, is dementia gets worse over time. So it continues to impact more of the brain. So there is a point in which no matter how many new neurons we grow, it won't work because of what dementia is doing. But in the immediacy, doing things every day to stretch how that brain functions is something you can do at home. Like using your non-dominant hand to brush your teeth. It really does work. Using your non-dominant hand to write your name and to write it, in cursive. It forces you to do something that you otherwise would not have been doing. You don't have to take the same route home every time. Go a different way. You have to be intentional with throwing a curveball at the brain to make the brain start to lay new tracks. Now, I'll ask you all in the room a question, and those of you at home, you can do it as well. How many vegetables and or fruit can you think of that are purple? Tell me. Eggplant, blueberries, grapes, blackberries, some onions, cabbage. Plums, they're thinking about it. Purple cauliflower, purple potatoes, purple carrots, yes. There's even a purple chicken. Yes. Chicken. Now, yeah, you're right, not a vegetable. Not that one, Tina. Now, watch what will happen. Later on today, when none of us are together, you're going to be doing something. You're going, oh, God, here's one. I could have thought of that. I could have thought. You are forcing that brain to think and work. It has to be intentional. Something as simple as that. Common problems, insomnia, restless leg syndrome, those are issues. Getting good sleep at night, talk to your provider. Don't be resistant to taking medication if you need to. Try some relaxation techniques. Deep breathing does work. Turning the television off, your smartphone, an hour before you go to bed so that your body and your mind can start to come down. It really, truly does work. Okay, here we are. All right, let me ask you all this. Those of you in the room can do it, and those who are at home, you can do it as well. Let me hear you say the word "oh." How about a happy O? No, a happy O. Oh, a angry O. A sad O. Oh my goodness. Now, this O stays the same. O is O. What changes the environment or the landscape is what you do to the O, the connotation of the O. If your brain health is going to change, it has to be what you do to it, because certain circumstances, they do not change. O is O no matter what, but I can make it a happy O, or sad O. It's what I do to this O that will make the change for the outcomes. If you make brain health a priority in your life and just say, every day, I'm going to do one thing for my brain health, and do that every day. It doesn't have to be the same thing every day. Even if it's as simple as reading out loud, brushing my teeth with my non-dominant hand, taking a different route home, doing something different helps give strength to the brain. It's very, very important. Very important. Now, that is the end of the slides that we have, and I'm happy to take any questions that you have in this room and any question for our folks who are on the camera. Great question. Why is dementia going to increase? Is it because people are going to live longer? That's one of the reasons why. Any other thoughts in the room? Why is dementia increasing? The population is getting older, the baby boomers and beyond. We've got more people over the age of 65. Every day, 10,000 new people turn 65 years old. 10,000 every day. So there are a lot more older people living longer. Therefore, and they're aging. They're more likely after 70, 75, it depends, to bump into Alzheimer's or dementia. Absolutely. She said, do I think the fact that their lifestyle, their mobility, is that a factor? Yes, absolutely. There are some populations at greater risk. Women are more at risk than men. African Americans are significantly impaired. They're 2 times significantly at risk, 2 times more likely to develop Alzheimer's than Caucasians. Latinos are 1.5 times more likely, and women are 2/3 more likely. A lot of it we attribute to stress and lifestyle. What are we eating? Diabetes, heart disease, strokes, ham hocks every day will kill you. Pig feet will kill you. Yes, your great grandmother ate pig feet every day. This is not your grandmother's pig. Your grandmother raised that pig and fed that pig. This is a different pig. So we can't eat that way every day and expect to have good mobility and good brain health. And it is very, very, very cultural. Very cultural. Yes.
Physically, where is the Martha Goodson Center located?
Yes, she said, where in the heck is the Martha W. Goodson Center? It's in Williamsburg on McLaw Circle. So right on 60, and that's where it is. You can come there and say, you know what? I saw Kim and Tina at an event. I just want an overall assessment. To have a team of people, 5 or 6, looking at every part of your body, helping you to live your absolute best, is a gift. You need an appointment, but you don't need a referral. You don't need a referral from your provider. You come in and see us, and there it is. There is a small fee for some of the services that insurance doesn't cover, but we can help you with driving. There are people who need to be assessed for driving because as we get older, our peripheral vision is not the same. You know, I just turned 50 fine. I call it 50 fine, F-I-N-E. I don't care how my mind tells me I'm 35, I feel 35. I know I'm 55. My body tells me there are things I can't do the same way. And as you get older, your ability to see, your peripheral vision is impaired. And the older you get, if you have certain brain changes, it becomes even more impaired. And people who are driving are more at risk for fender benders, all kinds of accidents, if they are starting to have that issue. We can help with that. We have a driving assessment that happens in our office. Some folks are like, I'm not going to come. They're going to take my license. That's not our goal. Our goal is to make recommendations to help you be as safe as possible. Yes.
How are the different dementias diagnosed, and what treatments are available for the different main types of dementia?
Yes, wonderful question. How are the different dementias diagnosed, and what are the treatments that are available? The majority of the treatments that are available center a lot around symptom management. The medications that are on the market are the same medications that have been on the market for the last 3 decades. Aricept, Riverside, Namenda, these medications have been on the market for a while. They are there to help manage the symptoms. Aricept is often given to folks who have Alzheimer's disease. And the way most of these medications work is this. If Tina has Alzheimer's disease, Alzheimer's is a disease that impacts the brain. It starts at different places for different people. It's not exactly the same for everyone. If my dementia starts right here, this is where the impairment is. It's impacting everything that this part of my brain controls. Some of my movement, my temperature regulation, my ability to think is impacted, but just a small amount because it's only right here. The doctor gives me Aricept. The Aricept can do nothing for this, nothing. The Aricept helps this other part, the healthy part, work better longer. That's what the medications do. Now, getting what's called a differential diagnosis, differentiating this comes in a lot of different ways. Information from the family, information from the patient. What's happening? What are you seeing? Some of it is imaging, testing, to figure out what is happening and the most probable type of dementia that this person has. Most providers will say it's probable Alzheimer's, probable frontotemporal dementia, probable mixed dementias. Some people could have 2 types of dementias going on at the same time. Very important, though, to know the type of dementia and to be working with a practitioner who understands how to differentiate that. A lot of it is symptom driven. What is happening? What is going on? What are we seeing? What are the behaviors? Not bad behaviors, just the mechanisms, how this person's acting every day. A lot of that helps give providers information in terms of what type of dementia they're dealing with. Great question. Yes. The question is early onset dementia more hereditary than the other types? And the answer is most often. No, I apologize. Not early onset, younger onset. So younger onset, there's a more direct connector with Alzheimer's. Younger onset happens to folks in their 45-ish, 60-ish, younger onset. If they have a gene, it's called the familial gene. If they have the familial gene, they can pass that gene on to their children at about 50%. And if their children acquire that gene, they will develop Alzheimer's disease. It's younger onset. Early onset just means I have the disease and I'm in the earlier part of the process. So people will say, I'm in the early part. I'm in the middle state. I'm on the last end. Early just means we're early, we're catching this really early. Younger is totally different. Great question. Yes. Is there a way to be tested for Alzheimer's? Because we just want to know, heck, do I have it? Am I at risk for it? The short answer is no. So is there a way? Yes, by a PET scan. And the PET scan may not say, yes, I have it, but you're at greater risk for it, because now The PET scan is the device where we can see Alzheimer's in the living person, which for years and years and years we could not. The tricky part is trying to get a provider that will write the script to pay for it because it's about $1,500. But you can certainly get baseline cognitive screening for all of you that are 65 and older. Every year when you go to the doctor, you should be getting your annual wellness visit. It's your annual physical, but you should also be getting your annual cognitive screening, which we know only 13% of providers around the country are offering. Medicare pays for it. That gives them more money. It's not just them asking you the 2 questions, because it should take about 45 minutes for this test. The doctor can do it, a nurse specialist can do it, a nurse practitioner can do it. You want to ask for it. It does several different things. And then year over year, they should be doing it. So you have a baseline to say, all right, this year, I was able to do this test in 25 seconds. All right, next year, oh gosh, I did it in 23 seconds. Is there anything going on? Maybe I'm under more stress. Maybe I just moved. Maybe I had a death in my family. That could be impacting that. You need a baseline of where your cognitive capabilities are. It could take about 40, 45 minutes. Yeah, ask your doctor, hey, I want to come in for my annual cognitive screening. They're going to do, it's a ton of different things that they do. And it's paid for by Medicare. And don't be shocked if your doctor says, oh, well, I checked it when you were here and I asked you A, B, or C, and because you did well on these 3, you're okay. There's 6 different parts of the brain, 6 domains. If Tina's got dementia and it starts back here, it might be impacting my temperature, maybe how I see, but my cognitive capabilities, my ability to take a test and answer questions may not be impaired. That doesn't mean that the Alzheimer's is not there. The screening tests everything. So you want the screening because they're looking at all these different parts. The good part is if they can identify it early, we can start to put mechanisms in place to say, do these type of activities to help that part work better, longer. It's called mapping. We can map based on what you're telling us, activities to help work on that area of the brain. Very important. Somebody on my team will do that. They will come in, they'll talk to you, they can do a comprehensive screening. And then we have what's called care navigators who can work with you individually and give you some tips and give you some strategies. Here's what you can do to help the brain and your body work better. Yes, 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 yes. Yes, ma'am. Great question. She said, when you develop dementia, is it true that your recent memories go before your long-term memories? Well, remember now, dementia shows the doctors that you're having symptoms. It's something else that's making it happen. So if you have Alzheimer's disease and it's starting to progress, Alzheimer's is a disease that gets worse over time. The longer you live with it, you start to lose memories in what I call retrograde. So over here is when, right now, Tina's 55 right here. Down here is where I was born in Detroit. All of my memories are on this little rainbow road, everything. When I got married, when I had my job, all those lovely things. As I develop Alzheimer's and it starts to regress and gets worse, those memories start to get traced away like that. The things that happen the furthest away, I can recall that information, yes. But if you ask me, what did I have for breakfast? I don't know. I think I should know, because then I'll just say, I had eggs and bacon. And I'm not lying, it's what I think I would have had if I had breakfast. Short-term memory is significantly impaired. Long-term memory stays intact the longest. Great, great question. And that's where we, and Kim is a big advocate in the state, working with lawmakers as well, bringing forth those types of questions. Is your provider bringing you information in different ways. That's why we want to test all parts of the brain. And don't just put the same thing in front of me this year that you gave me last year, because your provider has options. And I would say to my doctor is, isn't this the same test you gave me last year? You want to press them because you really want to know about your brain health. Great, great, great question. Yes. Any other questions? Well, thank you so much. And I'm so happy that you let us come today to talk to you about brain health, things you can do to keep that brain working well. Here's my colleague, Kim. Let her come here so you can see her face, those of you on the screen, as I'm talking about her and not showing you her. Kim does all these things. And she's been with Riverside for 20 years. And she's an expert in community, families, people, and she works with legislators as well. Tell them a couple of things about what you do, Kim.
So we're starting Mind in Motion. It's a 6-week session, and we'll be bringing it down to this area as well. We started in Gloucester. And so I'm everywhere that Riverside is, our footprint, and sharing resources, education, support. We're here for you to walk that journey with you. That's what the navigators do, because everyone is an individual and every situation is different. So we'll be around if you have any individual questions afterward.
Well, gosh. Thank you for letting me come. You let me wear green today, so I'm super thrilled about that. And I appreciate coming in this lovely, lovely space. We look forward to seeing you again soon. You bet.